Hello, my name is Matthew Stefanko, and I am a strategic advisor at Shatterproof, a national nonprofit focused on the addiction crisis. I'm here to talk about managing addiction stigma and treating pain and opioid use disorder. And in this session, we'll talk about some of the key ways that you can actionably reduce stigma for your patients on a day-to-day basis. The first thing I want to talk about is some of the effective communication strategies we've found in reducing addiction stigma. Now, some of the examples we'll talk about today are focused on large-scale health promotion campaigns. This might not be actually what you implement on a day-to-day basis, but many of the learnings from it can be neatly applied to what you're doing when you communicate with patients, when your organization communicates with patients as a whole, etc. First, I want to provide some framing on the types of campaigns we've been running, and then I can suggest some possible tactics and how that can translate. So, in 2020, Shatterproof, along with a number of other organizations, including the Pennsylvania Department of Drug and Alcohol Programs, as well as Penn State Harrisburg, implemented a large-scale, evidence-based 12-month educational campaign in Pennsylvania focused on addiction stigma. We began this work in June 2020, and we've been running it ever since. And we've implemented a lot of the strategies on the next slide with a lot of success. So here are some tactics that we've gone through and implemented at scale that might be good things for you to consider implementing at your organization or in your day-to-day life. The core of what we do comes down to evidence-based stories of recovery. The reason why we share stories of recovery is due to the research base related to contact-based strategies. The best thing to do is to take someone with a stigmatized condition and put them next to someone without a stigmatized condition and show them how similar they are. Often, the best way for you to do that is on a day-to-day basis, bringing in people who are in recovery and figuring out how to show their story to people that are providing care or that might be interacting with people with substance use disorders. Now, that isn't always possible. And so what we figured out were different mechanisms to do that at scale that didn't always rely on that one-to-one interaction. The first thing we did is partner closely with community-based organizations with this focus. As you can imagine, there are a lot of individuals who are in recovery who are supporting community-based organizations that are focused on addiction and substance use disorder. They're often very trusted messengers in their community, and they're often already working with people who are in long-term recovery that are comfortable sharing their story. The second thing we did is work with influencers and use targeted paid media. As you can imagine, influencers, especially influencers who themselves have a story of being in recovery, can be really, really good messengers. They've already figured out a way to connect with their audience, and they've already curated an audience of people who are reflective of their own experiences, and they've been telling their story to those people for an extended period of time. So partnering with them, either as messengers or using their platform in your community, can be really valuable. The final thing is using earned media, website, and social channels. This was the mechanism that we used to distribute stories of recovery that we collected and often figured out a way to bring that to scale. That may or may not be an effective strategy for you, but thinking about how to take stories of recovery that are either pre-recorded or recorded via a webinar or live stream and scale them out to a large group of people is very important. Fortunately, we found that this kind of strategy has been very, very effective at scale, and the first 12 months results from the state of Pennsylvania were phenomenal. We saw double-digit shifts in both campaign reach, the educational value of the campaign, as well as a number of key topic areas that we consider incredibly important for addiction stigma. One note here, I think it's very important when you're implementing interventions to reduce stigma that you measure it. Oftentimes, people don't believe that there is a way to effectively measure addiction stigma at scale, but there are a lot of measurement tools that are out there that you can access via Google that have been published that are well regarded that you can use to study the efficacy of the addiction stigma intervention that you choose to implement. I want to spend a brief moment focusing on healthcare professionals and some of the discrete findings we've found from healthcare professionals specifically. I want to do this because many people often think that healthcare professionals, because they are dealing with people with substance use disorders often on a daily basis, could not possess the same level of stigma as someone sitting at home who might not have those same interactions. Unfortunately, that isn't the case. We've actually found a fairly significant level of stigma between healthcare professionals and the way they treat their patients. Unfortunately, these numbers are quite surprising when we mention them to people, but these have been study results that have been replicated time and time again, and so it's important to trust their validity and think about how we can work against them. The first is that a very significant portion of healthcare professionals falsely believe that SUD is not a chronic disease, almost 2/3 in fact. Next is that we found that healthcare professionals, when they move out of the setting of healthcare and they actually talk about their willingness to be around people with substance use disorders as friends or having them next door, they possess an extremely high level of stigma. You can imagine how that might shape implicit biases that many of these healthcare professionals might have towards patients or people that they're treating. And finally, and very critically, almost half endorse the harmful belief that medications for opioid use disorder are substituting one drug for another. Now, we know that this is not the case, and a lot of experts within the substance use disorder arena would dispute this very ardently, but it is something that many people continue to believe. So what have we done to actually try to reduce stigma at scale with healthcare professionals? There are a few different approaches. We certainly recommend Shatterproof's evidence-based program, Just 5. This is basic education materials, only around 30 minutes long, and can help reset some of the false expectations that healthcare professionals might have as it relates to patients with substance use disorders. The second and the third piece are more in-depth interventions that have been developed, both the Reset Stigma module from Dell Medical School and a stigma reduction echo program that is being developed with Penn State University. Both of those organizations often talk about the efficacy of those programs and are always trying to figure out how to implement them at scale. So if this is something you or your organization might be interested in, I would recommend reaching out to them. Finally, I want to talk about language and the importance of language. This is something that often gets glossed over, but it's very critical to talk about because we know it is one of the biggest drivers of addiction stigma at scale. First, I want to draw a really important distinction between who can say certain words and who cannot. I think often when I speak with healthcare professionals, they believe certain words like addict and drug abuser and alcoholic are appropriate ways to describe individuals with substance use disorders because those are the words that they are hearing from their patients that have substance use disorders often. Unfortunately, we've seen in the literature that although people with substance use disorders often want to reclaim language that has been used negatively against them before, they still will believe that healthcare professionals that use stigmatizing language believe something negative about them. And so it's very, very important to not necessarily mimic the kind of language that you're hearing from the individuals in your waiting room, but to actually use some of the other terms that will be discussed on the following page. Shatterproof released an addiction stigma language guide about 1 year ago. And there are a number of addiction stigma language guides out there that your organization and you can study and implement at scale. There are many words that you might know are stigmatizing, things like addict and drug abuser, but there are other words like relapse that have been found to also be stigmatizing that are good to avoid. In summary, we do know that there is a common set of tactics we can use at scale to reduce addiction stigma, and that there are differences in the way that healthcare professionals stigmatize their patients and the way that the general public or community does. Finally, it's very critical that we address and amend language because it is one of the key drivers of stigma and something that we see continue to happen over and over again.